I'm Dr. Richard Finn, a medical oncologist at the Geffen School of Medicine at UCLA. Liver cancer is an interesting disease because, unlike most cancers, we know overwhelmingly who is at risk for it and who can get it. 90% of the patients who develop liver cancer have underlying liver disease. And that has evolved over time. Historically, in the United States, the most common cause of liver disease and therefore liver cancer has been hepatitis C. Globally, hepatitis B is a major driver. And then we know about other etiologies that can damage the liver, such as alcohol use, heavy alcohol use. There are some metabolic syndromes that are associated with development of liver cancer, one of them being hemochromatosis, or a genetic disease of iron overload. But increasingly driving the incidence of liver disease has been what we call fatty liver disease. Really, there's an epidemic globally, and especially in the United States, characterized by obesity, insulin resistance, and type 2 diabetes that can then affect the liver with abnormal fat deposition or collection of fat in the liver. We know that over time, that can damage the liver and lead to cirrhosis. So the common denominator for the development of liver cancer is liver damage and cirrhosis. Regardless of the cause, once you have cirrhosis, we know that the risk of liver cancer developing is somewhere between 1% to 3% a year. Now, still, that means about 10% of patients have no known risk factor. But given that we know who's at risk for liver cancer, it really behooves us to try to identify liver disease. And then once we know who has liver disease, then we have an effort to look for liver cancer and hopefully find it early. This can be a very highly curable disease. Cures typically would require a surgical resection. Sometimes we can just burn small tumors and patients can do very well. But a lot of people are surprised to hear that liver transplant is a fairly routine procedure done for patients with early liver cancer. And the benefit of that is it takes care of the cirrhosis as well as the cancer. But in order to have any of these curable modalities as an option, we need to find it early. Now, there's been very good developments in the management of hepatitis C. For a long time, this was not a curable virus. Now there are very good treatments that can cure patients of hepatitis C. And even though a patient might get cured of hepatitis C or is on medication that controls their hepatitis B, we still know that they can develop liver cancer later. So even though patients are adequately treated for these diseases, it's important that they and their physicians remain vigilant about the development of liver cancer and implement a screening strategy.